Hello,
Hey Megan, how are you? Can you hear me okay?
I can. Can you hear me?
Just fine. Thank you so much. Glad you're on this call, and thanks for making this all happen. We wouldn't be here without you. So I thought I'd kind of let you start things off and then pass the baton my way when you're ready.
Absolutely. So I only really have like one update to give everybody, well, maybe two. So the first one is and the board is looking to have a virtual meeting um, every month in place of our normal in-person meetings until all of the stay-at-home order is going on and until we can start gathering in a group again safely. So it'll be kind of a month-by-month basis. So be on the lookout for the emails and the Facebook posts. Those are going to be the two main ways of communication with everybody. So if you are not on our email list, you can either go to unitedspinal.org and sign up to be a member nationally and then affiliated with the Cleveland chapter. I will get that email to then add your information to our email list. We only send like 2, maybe 3 emails per month, so you won't be bombarded. Or you can email us directly with your information at United Spinal NEO, as in Northeast Ohio, at gmail.com. So United Spinal NEO at gmail.com. You can send your information to that email address and I can get you on the email list that way. Or go to Facebook, like our page, United Spinal NEO. There will be meeting events and all kinds of other announcements there. The second announcement is that there is a group of researchers at Metro Health. There's 4 different grants that have been applied to the C.H. Nielsen Foundation for up to $10,000 each grant. For items needed during the COVID-19 pandemic. So if you have a spinal cord injury or caring for somebody with a spinal cord injury, definitely be on the lookout for an email tomorrow with more details on that. But we are putting together like a package of face shields, face masks, thermometers, hopefully some gloves. We were still working on how to obtain gloves. So hopefully that, and like gift cards to get groceries. So if you are in need of any of those items, you can reach out to us at the email that I provided, the United Spinal NEO at gmail.com. Or wait for the email tomorrow with more details. Other than that, I hope everybody's being safe, staying healthy, staying at home as much as possible. And with that, we have Zach tonight. I don't know if he gave you any more of an intro to him, but with ReWalk, and he's going to give us kind of an overview of the clinical nature of the ReWalk system, and then possibly how you can get involved and possibly obtain one for yourself. So with that, Zach, thank you for being with us tonight and setting up this call, and it is all you.
Thanks, Megan. I really do appreciate your intro there. So, like Megan said, my name is Zachary Waugh. I am a physical therapist by background. I've been in the field for about 4 years as a licensed physical therapist, working with ReWalk for a few years under that. It's been a real fun ride working with a company that is developing cutting edge exoskeleton equipment, helping people across the board. So I've had the opportunity, especially young in my career, to travel across the country and really get to know some unique individuals with some pretty amazing stories. So you can see that here in this picture, I'm standing alongside one of our ReWalkers, Todd Riegelsberger, and the former governor of Ohio, John Kasich. So it was a real joy to be able to meet him and talk a little bit about kind of the big picture goal to make this technology more accessible to the users. Because that's definitely a question that comes up is, all right, this is cool and neat. How can I physically use one of these myself? I come from, I live presently in Ann Arbor, Michigan, so I tend to get pretty mixed responses from Ohioans when I tell them that. Closer to Columbus, I tend to be a little bit more cursed versus out over by Cleveland. So thankfully, it's an easy trek out your guys' way. So I owe a lot of my contact with you all and my connection with your chapter through Megan Hammond, as we've been in touch over the years, developing a partnership with Metro Health, which I'm sure many of you are aware of, where even the chapter meetings are hosted at. We do have a clinical partnership with that facility. So I'll talk a little bit how that works too. So without further ado, I'll kind of dive right into our technology. The way this presentation will work, you obviously can probably see that, other dialogue is pretty limited from your end coming my way. So if there are questions, try to save them towards the end of the presentation. I'll funnel and filter through those and answer them once I'm done. But you'll probably find that some of the questions you may have could be answered through this process. So it might be easier just to reserve everything towards the end. But certainly please use your type function to give me any questions that may not have been covered. So on this discussion, we will review the company of ReWalk overall. We'll talk about what the ReWalk exoskeleton is, who the good candidates for using this equipment are, the benefits to using such technology, the process for being assessed, evaluated, trialed, and potentially even pursuing your own device, and the resources that we have available to help you do this. So at the bare minimum, our mission is to fundamentally change the quality of life for individuals with lower limb disability through the creation and development of market-leading robotic technologies. I come into this profession as a physical therapist, so my first and foremost passion is being an agent for healing and recovery and physical betterment for individuals across the spectrum of ability. So there's a lot of work that goes into exposing the general public to this technology, but at the end of the day, I'm at my happiest when I'm in the clinic and I'm working with people like you all, showing you this equipment and seeing that aha moment when individuals stand up for the first time and start taking a few steps. It's, I've been with the company a little over 2 years now, and it still can be a pretty emotional process, being upright for the first time with this equipment. Whether you have the chance to look your spouse in the eye or can start to picture what it would be like to take those first few steps. I really do believe in the technology that we have available, and it's just a privilege of mine to help put it in front of people across the country. Taking the use of our technology to the nth degree here, we have a retired Army Sergeant, Terry Veraline, who recently completed the New York City Marathon back in November using her own ReWalk exoskeleton that was issued to her by the VA. She has been walking in a ReWalk since 2014 and has taken, at this point, darn near 1 million steps, if not well over it. Which is definitely testament to the durability of said technology. But I think even better yet is testament to her own physical, mental, and spiritual durability. I mean, that is not an easy feat to walk a marathon, to run a marathon on a normally functioning set of legs, let alone a set of legs that are assisting someone who may not have function on their own. So she's truly a source of inspiration, and we're finding people like her pushing the boundaries of this kind of equipment nationwide, and it really just captivates our interest. So on her left, your right, that is our own CEO, Larry Jasinski, helping her walk to the finish line. So, we really do take these stories to heart and want to be supportive to people who have their own goals, whether it's to walk their daughter down the aisle for their wedding or complete a marathon. We really want to kind of help people cover that spectrum of accomplishment in any way they feel they can. So the ReWalk stripped down is what's known as a powered exoskeleton in the health community. It provides powered hip and knee motion. So the actual motors in the device are centrally located at the hip joint in the knee to replicate biomechanical walking patterns. So users would transfer into this device, and it would allow them then to come to a standing position and then to ambulate in accordance to the natural requirements of human gait, namely weight shifting over the load-bearing leg. This device is cleared by the FDA for personal ownership and use at home and in the community. So we really do lean into that as far as it being a critical component to someone's overall quality of life, which I'll explain in the coming slides. I decided to take the audio off this video, so I'll kind of just talk through a little bit of some of the functional context of using this equipment, but some of you may have seen this before, but it's a really cool example of how this technology can be used in everyday life. So this first individual, this is Robert Wu. He's walking with his wife over at the grocery store. So it's nice to see that he's able to stop and start pretty easily on his own. We have Gene over here walking out in the field with his wife. We have another user walking out here in the public. So this device is really something that should be seen as integrated with everyday life and everyday use. Certainly there are benefits to using this from a strictly exercise point of view, right? Even just taking walks daily, whether you are able-bodied or alternatively abled, is shown to be helpful. But really, we're taking that a step further and giving functional application to a piece of equipment like this, and really allowing users who fit the criteria for safe use to do so in a multitude of different ways. So who exactly is a good candidate? When we are communicating with users who have an interest in this technology, it's really important from a clinical standpoint that we can answer these questions confidently. Because again, as a physical therapist, my #1 priority is safety above anything else. Safety trumps all things. So I want to make sure that their hands and shoulders can support the crutches or a walker. You saw all those users using forearm crutches. So having appropriate hand and arm function is essential to using this device appropriately. Healthy bone density. The device is imparting ground reaction forces through the legs. So we have to make sure that when we're assessing individuals that we are determining that they are safe to use this equipment from an empirical standpoint based on bone density results. No history of unhealed fractures. We got to make sure that people don't have a present bone break that hasn't been healing. Being able to stand using a device such as a standing frame, I think, is a really high predictor of success with this equipment. And it really, hopefully, is something that is as commonplace as possible for people who can tolerate it and that can benefit by it. This device is giving people the ability to stand. It's giving them the ability to walk. So to tolerate that, they need to be on some sort of, or it should be, it's suggested that some sort of standing regimen leading up to this be utilized. General good health, we want to, it would be the same as someone else who wants to walk. We want to make sure that they can tolerate walking from a cardiovascular standpoint, from a lung standpoint, from an attention standpoint. Being in general good health will lead to optimized use with this equipment. For a more technical standpoint, their height and weight typically between 5'3" and 6'2", but that really boils down to the length of their legs. So I have had some former swimmers who have abnormally long torsos and shorter legs that have actually fit the bill of being able to fit into this technology. But as a general ballpark, we do advise between 5'3" and 6'2". And it's really important that the weight does not exceed 220 pounds, just because, this is a piece of medical and technological equipment, and we need to make sure that we're not overtaxing the motors that could prevent safe use. So the goals of powered exoskeletons, right? I mean, I think it's very easy to come to the conclusion that, yeah, the ReWalk, the goal of using one is to walk. But why do we walk? What are the importances of being ambulatory? And I would argue that being ambulatory is quintessential to reducing secondary medical complications, which I'll explain in a little bit, improving long-term outcomes, and improving the quality of life. I think everyone here can kind of put their own narrative spin on the notion of what does it mean to be upright, facing your spouse, looking them and saying, hey, I can see you eye to eye. What does it mean to be able to walk alongside someone, maybe it's your dog or a family member, and keeping pace with them? So really, this isn't a question of what does the ReWalk mean to me. It's what does walking mean to me? What does walking mean to my quality of life? And for me personally, it's essential. I'm grateful that I can do it, and I would certainly appreciate having access to this equipment if I couldn't. So when looking at the research that supports this technology, I really wanted to point out this study here completed by the American Congress of Rehab Medicine back in 2013. It's an observational cohort study, and what I like about it is that there's a large subject size, nearly 1,000 people. So 951 subjects, all new traumatic spinal cord injured individuals, participated in a 1-year follow-up survey after discharge from 6 participating rehab centers, mostly SCI model centers. This study measured the occurrence of post-rehab rehospitalization rates within 1 year of injury, length of rehospitalization stays, and cause of rehospitalizations. Boy, that's a mouthful. What was the interesting about this study was that more than 1/3 of its participants were rehospitalized at least once within the 12-month period, and the length of stay averaged 15.5 days. When considering the most common causes of those rehospitalizations, we see that they're urinary tract infections, pneumonia, and pressure ulcers. When we think about these causes, these medical complications, they're largely due to being sedentary and to being in a seated, stationary position where your body doesn't have the ability to circulate its blood as well as it needs to, or to take a full breath as well as it needs to, or to shift its mass from one part to another so that the skin doesn't break down. And these are all due to being in a seated or, supine, aka lying on your back position, that could have otherwise been avoided by initiating a standing program earlier on. So we take that data and we take the importance of being upright, and we really try to communicate that not just to users, but also to medical professionals. It's a little bit more commonplace for me to discuss with someone, hey, if someone had an amputation, we don't want them sitting for the remainder of their life if there's an ability for them to be upright and walk. And I want to make sure I'm dialing back for a second and avoiding any sort of stigma against being in a wheelchair or utilizing one as a primary form of transportation. That's not the goal of the ReWalk. The ReWalk is designed to provide an alternative form of mobility for those who may already rely on a wheelchair or some other form of mobility to accomplish everyday life tasks. It's just like having another tool in the tool chest, so that way you are complementing the things that you want to do on a day-to-day basis. I would like to try to play this clip. I'm not entirely sure if you'll be able to hear the sound, so I'm going to just rely on anyone here who, I'll be able to see any messages, so I'm just going to hit play and see if you guys can hear this. If you can't, or if you can, just message in the Q&A that you can or can't hear it. Otherwise, I can just kind of talk over. This is Dr. Eskenazi out of Moss Rehab, who really helped pioneer some of the early research that led to the development of the ReWalk exoskeleton. So he has a very strong presence in the physical medicine and rehabilitation world, and he's really helped put this technology in front of users who've been able to benefit by it. See if you guys can hear it. Oh, sounds like it's difficult for people to hear. So I'm gonna verify that. Yeah, no sound on the video. Sorry about that, everyone. Long story short, Dr. Esquenazi is basically saying that by using this device, there's reason to believe, you know, if we can base our assumptions that standing and walking are beneficial, and there's a piece of equipment that helps to accomplish helps someone to accomplish the goals of standing and walking, then it's reasonable to believe that those risks for pressure ulcers, for UTIs, for pneumonia can ultimately be reduced. Furthermore, and we've actually had anecdotal stories of people who've even experienced decreased pain because they've been able to be upright and walking. So everyone's going to have a little bit of a different experience using this equipment. But again, the founding information that led to the development and utilization of this equipment aren't too far of a reach if we can appreciate what standing and walking can do for the overall health of an individual. See if I can go to the next slide here. There we go. In case all of that evidence wasn't enough, I wanted to help compile it into a more easily readable table for you here. So multiple clinical trials across the country have been repeatedly demonstrated that show that powered exoskeletons are highly effective for restoring ambulation and are safe for community use. In addition to that, multiple studies have found that using this device is going to lead to improved physical activity. Seems fair enough to understand that. You're using a device that's allowing you to walk. You know, and walking is a well-documented beneficial physical activity. By being upright, gravity is allowed to do what gravity needs to do, which is basically have a better impact on bladder and bowel function versus kind of being in that right angled position in a chair where everything can be a little bit more compressed. Pain is definitely, I've personally interacted with people who have experienced reductions in the amount of pain medication they need to take, but it's certainly something that could happen. We have to be careful about claiming it for everyone. But again, I'm not surprised when people say that they have a decrease in pain, because if you're in that seated position for, you know, 16, 18 hours of your waking day, yeah, I would have back pain too. Spasticity as well. The spasticity responds well to rhythmic movement of the body. I know this from personal experience, having treated people and done gait training with people. By giving compression to certain joints and imparting more rhythmic stimuli, as would be with walking, that spasticity can help to be reduced. Sleep, certainly. You know, after a good workout, or after just being active all day, or even just being outside all day, I find I sleep better that night. And then quality of life. I mean, you know, this is kind of the meat and potatoes here. I mean, we want to put a piece of equipment out there that people are truly going to find meaningful as an additive part of their life. So now that you've got kind of an understanding clinically of how the ReWalk works and the appropriate people for it, some of you may be thinking to yourself, all right, what's the next step? How do I put myself in front of using this kind of equipment? So it all starts with a ReWalk phone screening. I have my contact information, and I'll let you guys can take a picture of it, or I can email it to anyone that may want it. But before we're ever in a clinic, it's ideal for us to chat with you on the phone. We can answer a lot of these questions strictly by having a 10-15 minute conversation, but it also gives me a chance to get to know you. What's your story coming into this? Because I want to make sure that I'm getting all of the information I need to safely say, all right, let's take that next step and start thinking about putting you or recommending you towards a particular clinic that can support you for that clinic day. Following the phone call, there's just a small amount of paperwork that would need to be signed via DocuSign. So we've tried to digitize this process as much as possible and to simplify it so that way it's fairly easy for us to communicate back and forth. Just like getting a prescription for a particular particular medication, it is important that once we come to that trial day, that there is a script written by your physician that says ReWalk exoskeleton, physical therapy evaluation and trial. So that way it's on record showing that there's medical support for you utilizing this equipment on that first go. And then kind of that ultimate endpoint is getting to that clinic day trial with our partner facilities. So in the area, primarily we're working with Metro Health in Cleveland. Back home where I'm at in Ann Arbor, it's University of Michigan. We have partner facilities all across the country that we try to make as accessible to users as possible. So that way when they don't have to travel too far to take a look at this equipment. So during that trial, we're going to take physical measurements of your leg, of your pelvis, of your body. So that way we can determine, all right, how do we customize this device to you to make it fit? I don't know if you saw, if you got as good of a look on the ReWalk a little bit earlier, but there's multiple ways in which the device can be custom tailored to fit your individual build. I believe the combination of adjustments that can be made on the device is somewhere near 100,000 when you factor all of the different moving parts that we need to make sure fit your unique build. And once a device is assembled for a particular individual, and after we've assessed that they're safely fit in that device, there's no further adjustments that really need to be made. That device is then is good to go for them to use during that trial. During the trial, then we practice with individuals getting in the device, sitting in it. We help them strap themselves in so they're never alone during this process. And then we work on very basic skills of, all right, here's the 2 crutches in your hand. Let's practice getting you from sitting to standing. Once they're standing up, we work on very basic balance skills. And that balance is strictly skills-based. So we're never going to rush someone through part of the process. Some people breeze through it. Some people take a little bit more time. So we're going to make sure that they have a sense of balance, because it can be a very strange experience for people who may feel like they're floating over their legs the first time they're standing in a device like this. And then obviously once they've completed some of the balance, in that same day, we work on walking. And again, it's a very powerful experience. People want to just take off and start going, but oftentimes it's a few steps at first. They get their bearings, and then they take a few more steps. And then eventually, maybe they're walking 10, 20, 30 feet at a time, really getting the feel for it. So that's just the case for, a certain amount of users. It's not the case for everyone, but we make sure that through this entire process that we're grading how people are progressing. So you are being supervised by a trained physical therapist, you're being supervised by me, and likely another set of hands, as well as a companion that we talk about bringing in as well, who can be trained on this kind of equipment. So once we do that trial, and on the assumption that users progressed well enough and have the motivation to continue using this equipment, ultimately for their own personal use, we have a couple questions we have to answer. And if we've done a well enough service to you on the front end of this process, a lot of these questions would have been answered. Namely, how would a piece of equipment like this get funded? It's certainly we have a small pool of people who are willing to pay for this out of pocket, but we want to make sure that the bigger picture here is that we are positioning this equipment in front of reimbursement entities to eventually have them see this as a standard of health and medical practice. So our kind of poster process, if you will, is collecting paperwork and filing it with various insurance groups, Blue Cross Blue Shield, Anthem, what have you, to try to get this funded. And inevitably, it tends to be a patient process, but we have resources that can help through all phases of the process to try to ensure that success. So again, I have to keep saying this, that motivation and dedication to the process is key, because it's not a night and day thing. This will definitely be a journey that, you know, we will be on together. And me personally, since I work in this area, I will be there with you through this process. So usually the next question that comes up are usually more pertaining to specific kind of insurance payer groups. So right now, we do not have a presently instilled process for success with Medicare or Medicaid. However, we have initiated an application process to the powers that be under Medicare, Medicaid, that could potentially and hopefully grant approval for those devices. So if you have specific questions on your own insurance, it's worth giving us a call, because there is individual minutia between primary, secondary, managed, PPO, HMO. It's better to handle that on an individual basis. So again, when you contact us, eventually you're going to be contacting me, and we're going to be able to talk through this. I will say that workers' compensation is one of our more successful payer groups. So if you or if anyone you know is financed through some sort of workers' compensation payer group, we could definitely work with them to try to create a purchase or a rental option. We've had individuals go through grants. We've had individuals go through fundraising. There's state programs available as well, vocational rehab waivers, those being assisted due to being crime victims. So when we're talking to you on the phone that first time, it's also really helpful for us to know if there's any other equipment you have, how did you get that? Because if you were successful doing that, that helps us to kind of say, oh, okay, they had this insurance group and they were able to get this piece of equipment. You know, what were some of the strategies you used to get that? We want to continue to learn and grow and drive the industry as being successful providers of exoskeleton equipment for people. There's also the ability to use assistive technology loans as well. It's really important for me to convey how strongly our company supports those in the service industry. Or at least in the armed services. I mean, it's from the very get-go, we've always wanted to put this equipment in front of active and retired military men and women, because we recognize that some of these people come back and they come back injured, or they get injured later in life. And it's an honor for us to be able to serve them in any way we can. So presently, we have a successful relationship with the VA nationwide for those who are interested in this technology. So if you know any veterans who fit that clinical criteria that I outlined earlier, we do have a partnership with the Cleveland VA, in fact, around using this equipment. So it would require users to go to Cleveland, get an evaluation, and then they would have access to actually training on a device then at that spot, and to decide if this is something that they want to pursue. I also want to include the Semper Fi Fund, which for those of you who may not know is a fund set aside for those who have been injured or affected following service after 9/11 took place. So this is just an example of another fund that is available for people to access this kind of equipment. So again, when we're chatting with you on the phone, these initial parts of the conversation really help us to determine, all right, say you fit the bill for using this device. Say it's something that you want to pursue. How can we help you do that? And these are just various avenues for you to be successful doing that. So we have the initial screening, we have the assessment, we have the evaluation, we have the trial. We got through the obstacle course of getting coverage for a ReWalk device. This is what you can expect. That device is yours. However, it is at the training facility until you demonstrate successful completion of various basic and advanced skill sets before you can actually take it home. So that's the second hurdle, is actually training on the device. So Metro in this case, if we had someone who was approved of their own unit, that unit would be sent and assembled at Metro, and that would be available for the user to effectively earn, as well as their companion that they need to designate as someone who could help them in the event of an emergency. So collectively, the user and the companion have to demonstrate a level of independence, full independence, before going home with this kind of equipment. Once that ReWalk is in your name and you're training on it, you can expect full technical and clinical support. Again, I'm with you in this process, but we also have service engineers who are available and can boast fairly quick turnaround time should any sort of issues or difficulties come up. And now that we live in a very digital world, a lot of this assistance can be provided without us ever having to assemble face-to-face. So again, it really helps to expedite that assistance process. More importantly, you have this device, you're using it, you can, now you can start to reap the benefits of a more active and healthy lifestyle. We had to successfully acquiring this technology in the first place really is contingent on us as a team conveying that health value to any of these resources that are backing the device. They're going to want to know, how is this medically beneficial to this individual, and why is it more than just a toy? And that's something that we work with you to help to convey. And lastly, community fostering community. So we have, the ReWalk community is a very niche community. People who are users tend to know other users quite well, and they're very encouraging of many people, of all people through the process, from early use and exposure all the way to more advanced use. Just the other day, I remember seeing, we had another user complete the marathon, and he actually did it in the world's fastest time on his exoskeleton out in South Carolina. He's logged well over 1 million miles on his legs. And it's cool because he posted sort of like a digital walk challenge to other people. So in this time, especially in this time of quarantine, it's still important to be active. And people have had questions, hey, I'm stuck here in isolation, but I want to keep using this equipment. So it's really, you can hear me talking all day, here's how you could use it. But really, one ReWalker to another ReWalker is going to have a much more profound effect on building that comfort within this community. So that's something that we want to make sure that you feel comfortable dipping into, should you have that interest and eligibility for a ReWalk device. So as I wrap this presentation up, these are some of my final thoughts, if you will. And it's something hopefully that you really take into consideration if this is something that you feel could fit in with your life. The ReWalk itself is a well-documented and effective therapy for individuals with spinal cord injury. Walking and standing, it's important. The human body was built to accomplish these tasks. Again, that's not to stigmatize the use of a wheelchair or power chair in any means. Certainly not. It's more saying, look, if we have those individuals that can benefit by using this, it would be a disservice to them to not help them find ways to access this equipment. Training, customer service, and support are an integral part of our mission. I'm a PT. When I was back in the clinic, I was taking patient cases home all the time in my head. I would lose sleep over it. It's the same here. Whatever phase of the process, names and faces are really hard for me to forget. So I want to make sure it's my kind of public oath to you that we're going to help as much as we can through this process. And with that, we want to help position the different resources that are available to assist you financially for said equipment. But I want to clarify that financial status itself is not an indicator for people accessing this equipment. People have success with funds and with grants. So anyone who is using this equipment, there is one common denominator that unites all of these individuals, and that is motivation. If they are motivated enough to succeed and to push for their use of this equipment, that is going to help them in the long run. And we definitely thrive off of that level of motivation. So I'm going to pause here and let you guys, if you want to snap a picture of this, Megan certainly has my contact information too, but I'll leave this screen up. So that way, if you want to jot any of my contact information down, you can. And I want to open the floor at this point to any questions you may have. And certainly, again, I really do appreciate your time and attention here. I have to get used to the idea of I'm talking to a computer screen, you know, in these times of isolation when I'm so much craving being in front of you in person. So thank you all for being patient with me as I work through adjusting to this difference here. So I'll take a peek at some of the Q&A and see how I can help you out. First question I got asked is, can the ReWalk be utilized by someone whose size is changing? So what's important for us to determine before we ever put someone in the device again is, what is their height? What is their weight? How thin or how short are we anticipating that individual to be over time? And I know that with age, that certainly is a natural process. But again, because the ReWalk is modular, there are adjustments that we can make to the equipment even after the device is owned, pending they still allow the user to be within the designated parameters of the device itself. It's something that maybe someone's lost a little bit of weight, or maybe they've put on a little bit of weight, or maybe we've got a younger individual who's maybe in their early 20s but has one more growth spurt left in them. So again, we take that on a case-by-case basis. I would prioritize that their build and overall functional presentation still are going to trump compared to anything else. Let's see. I'm not seeing any other questions in the chat right now. Let me take one more look just to make sure. Oh, here we go. Is there an extra tall version in development? Great question. So again, the tallest individual I've put in the device is 6'4", and that thing was stretched as far as it could go. So before any developments can be made on the device for either taller individuals or for kiddos, we have to standardize this equipment as a medical precedent. And to do that, we need to make sure that we're continuing to gain success across the board in getting these devices covered for people. It's kind of a chicken and the egg sort of thing here, where there's individuals who want further development on the device, but more devices need to be out in the community first. So it's kind of, where do we start with that? And where we start with that is continuing to show exposure to this equipment and continuing to find success for people using this equipment. So I do see a response at, I'm 6'4". So again, I think what would be worthwhile is to give us a ring, give us a call. Maybe you've got shorter legs that might help you be in the device, but you know, it's certainly something that on this call I'm not going to automatically rule out. So I would love to hear from you. Let's see, back to the questions. Is there any maintenance after using this? That is a fantastic question. So we do recommend when users have this equipment, they are educated on ensuring proper, you know, maintenance on the device. Namely, the device comes with 2 sets of torque wrenches, and the users are recommended to torque those. There's a couple sets of bolts along the hips and the legs. And they're recommended to do that on a weekly basis, just making sure that everything is fastened and secure in order to maintain safety. So I would say that is the biggest maintenance. Keeping it clean is important too, especially in these times. We want to make sure that you're disinfecting, especially if you're walking out on a long sunny day and maybe you're sweating a little bit. It's good to wipe it down. Any sort of cloth disinfectant would be good enough to keep this device clean. So really, once you have the equipment, really you're just making sure that the bolts stay tight, which they tend to do. Again, they did that for someone who completed a marathon, and that you're keeping the device clean. So great question. Let's see. Great question. What is the estimated useful life of the equipment? So we have the device warranted for 5 years at a time. Additional warranties can be purchased, and it's not like after 5 years the device is just going to fall apart in your hands. But we really wanted to develop a piece of equipment that could not only tolerate the test of time, but the test of use. So we have people who have, again, logged over 1 million steps on their device. I don't know if I've even logged 1 million steps in my life. So being able to have that same piece of equipment last the duration of that many steps really is testament to how well a piece of this equipment can be used over time. So I would throw back that it's not so much time based, it's more based on use. And we're seeing that even after 5 years of ownership, these devices with regular servicing are withstanding that test of time. Let's see, are there any other questions? I'm looking at the Q&A and the chat just to check. Otherwise, I can let you all enjoy the rest of your evenings. I just want to make sure that I'll give probably another 15, 20 seconds just to see if there's any lasting questions. And again, you've got my email, you've got my phone number. So if there's something you wanted to ask me privately, by all means. Oh, here we go. Let's take a look. Another great question came in. What is the out-of-pocket cost without insurance? So the device is MSRP'd with a 5-year warranty at $135,500. So we are looking, you know, that would be kind of how we fund that device and the warranty entirely. All right. Well, thank you all for all of your questions. And most importantly, I want to thank Megan and your chapter of the United Spinal Association. You guys are doing really great work. It's a pleasure being out there, interacting with you all. I did come for a meeting, I believe about 1.5 years ago, chatting with some of your team out there. I really had a blast. So I'm looking forward to getting back out into Cleveland, hopefully maybe by late summer, early fall. Right now, like I said, we're just trying to line those benches for our clinic partners. So that way, once they're ready to go taking patients, we can, in good faith, give them individual recommendations for use of this equipment. Let's see. We have presently, I'm seeing around, we've got a good number of people on tonight too. So I will say, if there wasn't anyone in attendance on this call, I will have it recorded as well, and we can send that out so that way others can check this presentation out. So with that in mind, I do appreciate that, and I just want to leave you with this little quote of live for today, hope for tomorrow, and be ready for the future. We're definitely excited to meet you. So I'll just go ahead and end the meeting for everyone. It'll kind of boot everyone together. So feel free to reach out to me personally if you have any further questions. Thanks, everyone. Have a great night. Stay safe, stay home. Really, I'm excited to meet you all.